We were talking about Dr. Hetal Gor. It's honor to have her here in my show, Desi TV USA. So here is one of the patient treatment room, or I can say transformation room. So tell me, Hetal Gorji, what is this about?
So in this room, we provide different treatments. We have a radio frequency vaginal machine called Votiva, which does few things. So Votiva is a machine where, as we were talking earlier, when after childbirth, as we get older, there is a laxity of skin and the vagina. So this is a special probe which attaches. So every patient has a different probe. These are one-time use probes. We use it and we throw it away. So this probe goes inside. As you can see, the frequency or the radio frequency waves are delivered through that, and this probe goes inside the vaginal area, and we bring the temperature up to 42 degrees, and it's very well tolerated. There is no need for anesthesia. What that does, it stimulates the collagen, which is a tissue just under our skin, the epidermis and dermis, and that increases the elasticity. It is like a facelift for the vagina. It increases the thickness, the vascularity, the tone. Also, correct, and also it increases the muscle mass. So what happens, that laxity, it's like doing Kegels, and making your muscle tight. That's what it's doing. Advantage of this over the other version that I have, which is called Femilift, that is a carbon dioxide laser treatment. Carbon dioxide laser is the treatment where we make small holes with the laser inside the vaginal area, and that stimulates lots of collagen and secretion. So carbon dioxide laser is really an amazing treatment for vaginal dryness, tightness, shrinkage, which happens as we get older, and Votiva is good for stress urinary incontinence, laxity, because it stimulates more of the muscle. So that's the difference. Now the same probe can be used outside. A lot of times somebody's lips are very big, they are irregular. We can treat them with this without even cutting them, because it shrinks the tissue, so it gets them a really good shape. So this is the treatment we use to kind of, when people have different in the sizes, either big or stuff, we can fix it, how the look of the lips of the label area is. Also, we do a lot of vaginal whitening and anal whitening. Nowadays what happens, there is a lot of hyperpigmentation, especially our skin, we tend to get, and especially private parts, there is a lot of hyperpigmentation because of irritation. So we provide a whitening peels here, which is done in a private setting, nobody has to know, and I kind of compound it depending upon what's the need. So we do provide that treatment of vaginal and anal whitening. So these are the two machines that are for the vaginal area. Also, the same machine, we provide what is called Morpheus. So Morpheus is a condition where we use to resurface our skin. It's called microneedling, right? So microneedling, it's commonly known as vampire facials.
Exactly.
So
for the face.
So this is for the face, but this probe, as you can see, is huge. The surface area is big, so it can be also used for body. A lot of us are mainly concentrating on the face, but there are people who wear a lot of bikinis and stuff. They don't like wrinkly skin hanging around. Morpheus is the treatment for that. What it does, that the radio frequency, there are needles which comes out, and depending upon either on the face or the body, it makes small holes, and those small holes are stimulating the collagen. It's the same thing as carbon dioxide laser or radio frequency. The whole idea is to stimulate your own body to produce the collagen that's going to increase the look of it. So we do provide through the radio frequency and Morpheus either the face or the body or the back or even the labial tissue to get a better texture and look of it. So that's the machine that we provide, two things, and it's really a great way, because without any big cut, without any big surgery, in a privacy here, you get treated. Onto your right, Shikha, that's a machine which is the laser hair removal machine, where the advantage of that is if you go to any other place, this is any laser has to be very specific to your skin type, because if you use a wrong laser, you can get hyperpigmentation.
Yeah, and especially our skin is
Correct.
very sensitive, and it can get scars and burn,
Exactly.
Yeah.
So I've had patients who have had treatment somewhere else, and they have come here to fix it. So the laser that I have, the Cutera one, it's really XL-HR it's called, and that is the one which can be used from skin type 1 to 6. So that's the machine, and as you can see, I'll come along. So this machine, how it works is that the probe comes out, and this part, when you touch on the skin, it cools the skin before it fires the laser. So that's the advantage. That's how it's very painless. So this machine can be used for laser hair removal, for spider veins, for even for face resurfacing if you want a mild one without. So the carbon dioxide does it, but I would not advise carbon dioxide laser for our skin type. It's good for 1 to 3. They get amazing result. It's as good as completely new skin, but that's only for skin type 1 to 3. If it's somebody who is skin type 4 and 5, then I could do this laser, which is Nd:YAG laser, 1064 and 755 nanometer frequency, and that can be used for our skin type. So this is used for spider veins, for pigmentation, for scar, for hair removal, for facelift. So as you can see, we have different modalities, and depending upon your skin type, what is needed. Like if you have hyperpigmentation as well as you have some spider veins and you have hair issue, we should do this because we can get rid of so many other things as well. So that's the importance of coming here, because we have so many different modalities that we can help you.
And the results you see, like
so for the hair removal, you need 6 treatments. So it can be anywhere from 4 to 8 weeks apart. So you will see 80 to 90% decrease in the hair growth by 5th and 6th treatment. So it's a little bit patient, because this, unlike any electrolysis, it doesn't destroy the top layer. It destroys the hair follicle.
The base.
Correct. So the hair is not coming then back. So that's why it's a longer treatment, but it's really effective. Like for spider veins, you need only 1 or 2 treatment. For hyperpigmentation, you need only 1 treatment. For acne scar, you need 1 or 2 treatments. For active acne, you need 1 or 2 treatments. So it depends on what we are doing and why you are doing. So going back to the question, how many treatments and when do we see result? So either with the Femilift, the carbon dioxide laser, or with Votiva, the vaginal radio frequency, you need at least 3 treatment 1 month apart. But after the first treatment, there is so much improvement that patients keep coming back, and then we ask them to come every year for a maintenance. Morpheus, if you are doing it like the microneedling for face or body, you don't need more than 1 or 2 cycles. So usually they are also 6 weeks apart. I usually do a special package for them because they have to come back, and we give them a lot of skin preparation and peels also along with that to go. So it's a big package that you get.
It's a whole treatment, like basically you get like from A to Z.
Absolutely. So we'll go to the next room and we'll show you the different other modalities we have.
Okay.
So ready? So, Shikha, as we've been talking about different modalities of treatment, this is another machine that I have, which is similar to what we showed you other room, the Morpheus, but this is a little bit less damaging. So there are certain people I have who cannot be outside their job or not in a public eye for a week or 2. So when you do the microneedling, you cannot go out because you're going to have small holes for 1 to 2 weeks. So a lot of people don't have that luxury, right? So this machine is the one which gives a slower result. That means you have to come every 2 weeks 6 times, but there is no downtime. So you can do it today and you can be out this evening without anybody knowing about it. So this provides...
So you don't get any scars, you don't get any spots.
So even other one doesn't give you scar, it just gives you scabs and the small holes initially.
Mostly when you get the facial treatments like Botox or fillers or anything, now these days they are very in as well.
Correct.
But then you can go out.
Correct.
Because if you have a very sensitive skin, you get all the scars on your face and swelling and everything.
And I'll come to those in a second, because I have very different opinion about those things, and I do provide something which is similar results without putting toxins in it. So if you come and see, this doesn't have small holes or anything. All this does is just the radio frequency, and then you massage, and it's doing the same thing. This probe will tell me how much temperature is going, so we are achieving the same result of increasing the temperature to stimulate the collagen. Radio frequency has been used in a lot of different medical field, right? We use it for cardiothoracic regions to kind of damage the blockage in the veins and stuff. So it's been really used for a lot of medical conditions with improved.
We've been talking about radio frequency. So do you suggest those treatments for pregnant women as well?
So usually we don't advise any of the either lasers or radio frequency for pregnant patient, because we don't have long-term results. Usually pregnant patient, we ask them to come after like 2 months after delivery for let their body, so I recently had a patient, a long-term patient of mine, and she has this now stretch marks that she wants to do it, and I told her to wait at least 2 months after her delivery now, and then to come in, because your body will react and it will improve some of the things.
Right.
Let's see how much your body heals yourself first before we do anything. Some treatments, there is no contraindication with breastfeeding, some there is, so depending upon, that's why it's important you go to the right person. Now in this same probe we have another way that we can attach different attachments to do similar microneedling that we did with the other, but here they are a little bit less invasive. So somebody who wants to be in the middle of the road, we can give them that. So we have different ways to kind of treat people without, depending upon what their expectations are, what they can do.
Their schedule.
Exactly.
Yes.
So that's the advantage. So this is one of the latest machine we have called BodyTite and AccuTite. What this does, traditional liposuction, we put the liposuction machine inside, which is literally like a suction cannula, and we suck out the fat. What happens with that? There's a lot of blood loss, there's a lot of pain, people have to be out of work for a month to 2 because they have to wear special garments and swelling, and they are leaking. We cannot do with if people have any diabetes, blood pressure, anemia, cardiac, illnesses. So this is called tumescent body tight. What we do first, we first inject a special saline with anesthetic. What that does, that increases the amount of fat separation from the skin, and it makes it very, very painless, so there is no need for general anesthesia. Then we put in this radio frequency probe, and that heats up the fat, so it makes it a little liquidish, and also it coagulates the blood vessels. Along with that, so we do a deeper layer, and then we do the superficial layer. Superficial layer will tighten the skin and improve the texture.
So it works in both ways.
Correct. So imagine if you take out a butter from the fridge and then you have to make pieces, how hard it is, right?
Right.
Same way, if you have to suck out the fat without liquefying it, it's going to be very difficult.
Yes.
With this technology, it is kind of melting the fat, making it softer, so it's easy to suck it out.
Exactly.
And
Painless.
And it is painless. And secondly, it shrinks the blood vessel, right? So what happens, the bleeding is minimum. And then we suck out the fat, and now going to your question about fillers and Botox, that fat that we have taken out, we can process and we can put it in. So we can put it into cheeks, we can put it into butt, and use your own body rather than use, fillers and stuff, because any toxin that you are putting inside your body, it gets absorbed in you. And then depending upon the filler you have, either you have to go back every 2 months, 3 months, or 6 months to keep putting it back and back. Imagine the amount of toxin, plastic, that actually you're putting it inside you. I really get very concerned with that, because we don't know what that toxin is doing into you. That's the same reason I really don't do Botox, for the same reason, because you are injecting a botulin, which is a toxin inside you. Eventually your results are not going to be the same. They're going to change because your body gets accumulated to that. But also, you put in this toxin weeks after weeks, we don't know what's going to happen. So I'm very, very much against silicones and fillers and stuff. I like all the treatment we provide is there's nothing foreign going inside you, and whatever foreign going inside is your own thing.
So
right?
basically you're saying the Botox, whatever is in right now, people spend, and that is expensive too. It's not like, but this is something like it's a permanent.
Correct.
You spend money, exactly, because these machines and processes and your time is also, it's expensive. So the Botox, even if you're paying like every 3-4 months, but at the end of the day, your skin get used to.
Correct. You're not going to get similar results.
And
you
might need more
and more injectables coming more and more frequently, right? First, you might not do it for 3 months, then you have to do it every 6 weeks and stuff. Also, you're putting toxin inside you, right? So yes, it's a little cheaper way to do certain fixes, but it doesn't fix everything. But also you have to understand, it's like when people come for laser hair removal, right? They said, oh, it's few hundreds. I'm like, imagine how much you are putting it in shaving, in razor or wax, or
and
add this up.
You're not satisfied.
And your time, right? Every 2-3 weeks you have to keep going. Imagine you're doing it for life, right? And now you're paying few hundred and you're getting like 90% hair loss. There's no comparison, right? Yes, it's a little bit investment at initial phase, but you add up
longer
and you add up,
safer.
And it's safer, it's permanent, it's much expected,
right.
And then you don't have to shave. Like I did it for my girls before they had a swim competition and stuff. They would be very worried. Now they don't have to worry. Wherever they have to go, they have to go. Other thing that we provide here is called PRP. PRP is this is a special machine where we take patient's blood, we spin the blood, it separates the plasma with the platelets. So to answer the question about fillers and stuff, that same PRP, the platelet-rich plasma, we inject into either the below the eye for hollow-looking eyes, or we have scars that needs to be filled, or this cheek, right, the cheek, the nasolabial fold, the crow eyes, all that we can kind of fill it up with the PRP. Also, PRP has been used for big-time athletes. They go to get PRP for their joints. What PRP does is the same thing. It stimulates the body to kind of newer tissue. So these athletes, they go and inject PRP in their knees, in their elbow, in their shoulders to keep them functioning good, to reverse the damage to their cartilages. So PRP has been also used apart from, so after we do the microneedling, we put in the PRP to stimulate more collagen, and it just gives you that good glow. It also has been used for vaginal area, for somebody who doesn't get orgasm or has dysfunction, it can be used in that area to improve the function and the tone. So we can combine it with 2 treatments to give a better result. And lastly, it's been used for hair, to kind of whenever there is a hair loss. Instead of transplant, we inject this in just below the skin in the scalp, and it stimulates your own body to produce the the new hair follicle. And all this treatment, except for the vaginal treatment, of course, we provide here for men as well as women. So it's, even though I'm an OBGYN, the cosmetic and medical spa is for both men and women, because men do have the unwanted fat. They do have.
These days, men are more aware too.
Absolutely.
They want to get everything done. They want all this stuff too.
Correct. And why not? Like we women have fought to be equal, and I think men need to be equal in this field as well. So we do the hair because some men can have excessive hair on their chest and the back. We do the hair removal treatment for men, and as well as, and we're going to do a Father's Day special in June. So we do provide for men the hair removal treatment, body sculpting, even the face. They are coming for face rejuvenation. So we do like a mild one for them because they do feel shy if they they have those micro needling pore. We do for the hair loss. Even if it's a hereditary male pattern hair loss, it can still be used. So there are a lot of different things that we can use for. So thank you, Shikha and Desi TV USA for interviewing me. This is Dr. Hetal Gor. Thank you so much.
So hi guys, this is Shikha from Desi TV USA. So here we are. We had a very nice chat with Dr. Hetal Gor, OBGYN. And through talking to her, getting to know her experience and everything, it's just not like, something we are talking about like from above. It's basically what she was explaining about her treatments is she is get into deep insight of each and every treatment. And that is basically only comes from the professionals and only comes from the experienced people in this field. And I would suggest everyone, don't go for anyone wherever you see, like, because I've been watching every day on Facebook, everyone media, like, they have low packages and, attracting like, viewers or clients that they should go to them. I mean, before you pick anyone, don't just see the packages, see the experience, the person have, that counts a lot. Even though I understand you have to invest your money to get the treatments done, but this is an investment. It's relate with the skin. If God forbid you have some scars or somewhere because you find some cheap deals there, and then, you gotta go back to some professional again and repay over and over again, to fix that. So it's better to find somebody, who is professional and who knows what is she doing and what is she talking about. And I would suggest and recommend Dr. Hetal Gor for all these treatments, what she was talking about. And she does have packages too, like she have offer for the Mother's Day, and then she have an offer for the Father's Day. So please do call Hetal Gor. And her spa is located in Englewood, New Jersey. You can find more about her information through Guys, if you want to know her information, that's her Better You Medical Spa, and her information is down here. It's www.betteryoumedicalspa.com. So just Google her and search on her this site and call her. That's her number, 201-541-6858. With this episode, I'm signing out. Keep watching Desi TV USA with Shikha, Weekend with Shikha.